Well, hello everyone. In this video, I would like to talk about the COVID-19 pandemic, specifically in Indonesia, and its connection with public administration. As we know, the COVID-19 outbreak is still a huge problem for many countries in this world, and needless to say, for Indonesia. Public policy is urgently needed for a situation like this to prevent a bigger problem caused by this outbreak. But in fact, the situation we're facing right now, it seems like there are no policies for this outbreak, and the government seems clueless. This cluelessness is reflected on daily COVID-19 cases. The graph shows that it's still increasing, and of course, this is not a good news from Indonesia. Experts have urged the government to implement stricter social restrictions to curb COVID-19 transmission as fatality and positivity rate continue to spike. Stricter restrictions were essential to prevent more people exposed to this virus. Arya Fernanda, Dean of the University of Indonesia's School of Medicine, said all regional leaders should implement stricter social restrictions to curb COVID-19 transmissions. Arya highlighted the recent spike in the COVID-19 positivity rate amid the low testing conducted by the government. The positivity rate in the past few weeks was recorded at 21.5%, with 6,528 out of 29,425 people tested for the coronavirus confirmed to have contracted the disease, meaning 1 out of 5 people's test results came back positive. The number of active cases was recorded at 108,452 cases as per Sunday, while the number of suspects nationwide was 69,325 people. The huge number of suspects compared with the number of people tested indicated a low level of testing conducted by the government. Arya said the increasing number of active cases had overwhelmed COVID-19 hospitals across the country. It's very hard to refer patients nowadays, as a lot of COVID-19 isolation rooms and ICUs are fully occupied. The medicine supply has also thinned out, and a lot of health workers have been infected and died because of COVID-19. Tri Maharani, an emergency doctor with Indonesian volunteer group Lapor COVID-19, corroborated Arya's statement. It's getting difficult to refer patients. Several hospitals in Blitar and Nganjuk Regency in East Java have even set up tents to accommodate patients. However, the number of health workers, especially nurses, is limited at the moment, Tri said. As healthcare workers were overwhelmed by the surge in COVID-19 hospitalizations, the mortality risk for COVID-19 patients treated in the ICUs had also increased as a result of delays in receiving intensive care. Not only health workers, mortuary personnel are also overwhelmed as the death toll continues rising, announced 215 more COVID-19 deaths, bringing the total number of fatalities nationwide to 21,452 people out of 719,219 recorded cases. Last week, Indonesia recorded the highest one-day death toll since the pandemic hit the country in March, with 258 fatalities based on the data collected by Lapor COVID-19 from regional administrations across the country. However, the number of deaths was recorded at 24,945 people, while the number of deaths among probable cases was 24,917 people. 3 said the number of health workers who died of COVID-19 infections had also risen. 4 health workers passed away on Sunday, bringing the total number of fatalities to 499 people, comprising 227 doctors, 158 nurses, 69 midwives, and others, she said. Unless the government sets up measures to curb COVID-19 transmission, the hospital will never be able to accommodate the spike in patients, even though we continue to add more isolation rooms and ICUs. The COVID-19 outbreak became a public administration issue because it's related to the public policy. How the government made the right public policy, even though implementation is a different thing. As mentioned before, it feels like there are no public policy in Indonesia. It is reflected by the number of daily cases that are still increasing. But I, as a person, do understand that we can't put economic above health and vice versa. So what we should do is to take a moderate way. But what happened now is, I think the government is too permissive, and it leads to a high daily COVID-19 cases. From that information, we can take a conclusion that it is a problem that requires policy and implementation. And the next thing is about the approach. I will use institutional approach for this issue. Institutional approach to the study of public administration concerns itself with institutions and organizations of the state. The core area of this approach lies in the details of the study of the structure, the functioning, rules, and regulations of executives, legislatures, and departments of the government. Institutional approach, we can see that our institutional power is not powerful enough to implement the public policy related to COVID-19 outbreak. For instance, in the early pandemic, our ex-Minister of Health seems to not care enough about the COVID-19, and it leads to a huge problem for Indonesia, because it is a really wrong decision to underestimate this virus. And where are we now? Yes, new record of daily cases is still happening in Indonesia. From that example, we can take a summary that our Minister of Health take the opposite decision, which is to prevent earlier about this pandemic rather than underestimate it. Perhaps we are in a better condition than what we are today. The Ministry of Health is playing a big role as an institution in this outbreak. But in the early pandemic, as I said before, even our Minister of Health seems to not care enough and feel this outbreak isn't a problem. This is why I choose institutional approach, because as an institution, Ministry of Health should know more about the problem and act more responsible. So the conclusion is, we have state institutions, but I think our homework is piled up. Start from what we should do if there is another outbreak, how to prevent it to become a bigger problem, etc. Indonesia's institutions must work harder and implement what has been written in public policy. because, as you know, public policy and implementation can't be separated. I think that's enough. Thank you for watching this video. Thank you for your time. Have a great day.